honor for me to moderate this first panel, where we will speak about the trends on smart textiles. And for that, we invited 5 experts from our network. The first one, without any delay, Dr.Yesim Oguz from France. Yesim is a project manager specialized in smart textiles at IFTH, the French Institute of Textile and Clothing. She has a PhD in automatic and sign-out treatment and a master diploma in a textile engineer. And she has experience in the field of smart textiles and is the author of co-author of 2 books, 1 article, and 6 conference papers. So, Yesim will speak the trends of textiles in healthcare and medicine. The floor is yours. Thank you.
Greetings, everyone. My name is Yesim Oguz, and I'm an R&D engineer specialized for smart textiles. I'm working for IFTH, which is a French Institute of Textile and Clothing. And I have also a role in this cost action as a working leader of working group 1, leader of working group 1, smart textiles for healthcare and medicine. So, as you know, textiles, we knew textiles. The first function of the textile was protect man from cold, from rain, and then we liked them for their technical performances. But today there is a new generation of textile, because textile become smarter and interactive. The smart textiles are defined as the textiles which can sense, react, or adapt to environmental conditions or stimuli like thermal, electrical, mechanical, or else. A working group, an European working group of standardization worked on the definition of smart textiles, and they devised in 3 categories smart textiles by looking these 3 functionalities: sense, react, and adapt. If you want more information, don't hesitate to search on internet CEN TC 248 WG31. So smart textiles are used in different fields. We use them in sports, transports, protection, building, or fashion, or else other fields. But the medical application of smart textiles is a key to success because there is a real need. Why there is a real need? Because today, sorry for the, I used a punto which was not adapted, I think. So it's different. As I was saying, today there is an increasing attention to health nowadays. So that's why that's related to global aging of the population, the increase in life expectancy, and also the concerns about the rise of the obesity or the chronic diseases like diabetes, cancer, or heart diseases. Of course, there are some difficulties to access to the success. So it's very complex to use smart textiles in medical applications because the authorizations are very long and also expensive. Also, the safety of the data is very important in this field. But there are already some examples of smart textile projects in this field, and some of these developments already replaced the traditional ones. So there are 2 challenges for tomorrow. First of all, decrease the hospitalization time, and the second one, increase the possibility of getting older at home with monitoring and home support, of course. This will provide us a life which is healthier, low cost, all while being independent. These developments have three benefits, like early diagnosis, disease prevention, and treatment. Here I gave some examples of the products on the market, to give you some examples. For prevention and diagnostic, we can use smart textiles for biological measures, like respiratory frequency, movement, blood pressure. Here, the example that I have chosen is the Somnonaut project from BioSerenity. It's a wearable for sleep disorders. This cloth has textile sensors inside of it. And compared to the traditional treatment, it's better because we are in our comfortable clothes. So we can go to sleep normally as we are doing at home. So the diagnostic is more real than going to hospital and putting many sensors on us and trying to sleep normally to show the results. For the treatment, we can use smart textiles for light therapy, drug delivery, or prosthesis, or else, of course. I chose the Phosystos project here. The aim of the project was developing light-emitting textiles for the treatment of precancerous skin conditions. In the traditional method, it was a photodynamic therapy with light-emitting diodes, which are very rigid. But here, the textile is very flexible, so it's applicable on all body parts. So light delivery is more homogeneous. The treatment is less painful, and in the end, this is also ambulatory. We are independent. We should be in the hospital with a big machine all the time. And the last one, for home sport, I chose the example of SenseFloor. For home sport, we can use textiles for detection of falls or for detecting the intruders. And this SenseFloor project is a good example for this. It's a connected floor which can signal presence or falls. And finally, in my last slide, I would like to talk to you on the trendy materials in smart textiles by giving the examples of applications in healthcare and medicine. Conductive fibers or polymers are generally used as sensors, like textile sensors, because conductivity depends on many environmental stimuli. So we can use them like textile electrodes to measure different parameters, biological parameters. But also, if we can insert conductive fibers in a textile to develop a heating textile for well-being. Light-emitting fibers can be used for light therapy, but also we can use like optical fibers for data transmission or monitoring. Nanomaterials are very advancing on these days because we can add some functions on the textile, new functions on the textile, by keeping the breathability and also the touche of the textile. Shape memory materials are generally used for the prosthesis to replace some part of the body, like tendons, muscles. Self-cleaning and antibacterial materials are very also used in medicine because this field especially necessitates more hygiene than others. Chromic materials are used to signal a change in the environment, and phase change materials are generally used for the comfort, like surgeon gloves or bedding in hospitals. And finally, energy harvest materials. We need energy in every field, of course, but especially in healthcare and medicine, like when we are doing monitoring, when we have sensors on us, we need energy all the time. But if we can create our energy, then we will be just independent. We will not be dependent on a battery. So I would like to take you to everyone. And if you have any questions, don't hesitate to write me or my colleagues.
Okay, thank you, Yasmin. Please.